create a space that promoted a positive and healthy environment for teachers and students in support of improving health, knowledge, and awareness. By creating this room, we have established a safe space where students can learn and grow during HFLE class and health club meetings. This room is also available to all students during break and lunchtime. With the help of our amazing art teacher, Ms. Sion Beckles, and the fabulous grade 11 art students, we were able to create 2 murals in the space to promote creativity and teamwork.
Adolescence is dubbed a unique period of challenge and opportunity for positive development. It is a time for exploring, for getting to know oneself. It is surely not a time to become a parent. The decisions that you make today, they're going to impact your future for the better or for the worst of it. However, the thing is, you get to decide which it will be. Adolescence is a very vital period that will determine how a person will view and interact with the world as an adult. If adolescents are healthy, this is typically the time when they're at their peak strength, speed, and endurance. They have more independence at this phase, so they need to learn to eat healthy and to exercise without being prompted by their parents. Further, as children become adults, they're faced with new intellectual challenges. Their schoolwork becomes more demanding, they're supervised less, and need to manage their time and their schoolwork on their own. Additionally, although children do have friends, and much of their social contact is with family members, during adolescence, people begin to make more friends outside of the family circle and to spend more time with their friends, as you guys know. Further, when we become adults, we gradually take on moral responsibilities. Adolescents are faced with difficult moral dilemmas. They must decide for themselves. For example, is it right to stand up to a bully? Must I follow my parents' religion? Is it okay to cheat on a test? Is there anything wrong with using drugs and alcohol? Is it wrong to put me first? Do I have a responsibility to help others? Is physical violence ever justified? If you're a parent, you may feel like you know all the answers to these questions. An important element of maturity is creating an identity that is distinct from your family of origin. Even a home that has the answers to all these questions, a teenager needs to assess and to make decisions for themselves. Finally, adolescence brings a host of psychological changes and challenges.
Moreover, the vision of educators is a holistic development of children. It is understood that the needs of children expand way beyond the fulfillment of academic goals. Therefore, catering for the maximum nurture, healthy growth, and development of children is of utmost importance. I therefore count it as a great privilege to be a part of this memorable and history-making event of the commissioning of the first HFLE, that's Health and Family Life Education Room, of its kind in Region 3 and perhaps the entire country.
I came up with the idea along with Lucy, my boss, and HM and Miss Tracy last year in March. So we started working on the room then, cleaning out all of the whatever was in the room and making it clean so that we could start putting together this room. The room was initially created because HM realized that like HFLE classes sometimes can be noisy and we need space and we need like resources to teach the materials. So it was kind of the idea of like creating a space where like we had room and we had like tables where we could do group work. We have resources to like reproductive systems so we can like relate to those. And like a projector because we have a ton of videos to show in the class. So the goal is to just create a safe space so we can like also discuss these different topics and so those kids could feel comfortable while they like learned.
As the volunteer would have said, that Leonora Secondary School, we had the space. After the volunteer was attached to the school and we look at the role and the policy that they Peace Corps volunteer would have expected us to do. We decided that this room is here. It was formerly the visual arts technical drawing room, but that subject was not being done here. It is used to be done at PIC. So we decided to transform this room into the HFLE room. And so I would have talked with the Peace Corps volunteer along with the program manager, and we had the ideal place for it. And so we quickly run ahead with the idea, and we get things done through the help of the PTA. We are so happy about this room, and so I didn't allow it to go on. I just quickly grabbed the opportunity and said, yes, miss, we have the space here. Come on, let's go with it.
Thank you. I'm Yemi Oshodi. I'm the Director of Programming and Training at Peace Corps Guyana. And from our perspective at Peace Corps Guyana, we're just so happy and pleased with this room. For us, it stands as such a great example of what can be done in other schools throughout the country. For us, we also see it as both my colleagues have said, we see it as an opportunity to create a safe space for young people. The conversations that are had in HFLE curriculum, as you know, are, they're conversations that require a safe space in a lot of cases. They require quiet, they require peace, and they require the opportunity for students to be able to discuss and share. And so this space allows just that and more. And so while we don't have a specific example of where we're going to be placing a Health Hub next, we do see this as an example that's perfect for volunteers and teachers and schools to be able to emulate. And we have two wonderful examples of individuals who can serve as examples as a best practice that exists here.
My name is Mohammed Rashid. I am 13 years old. I am Form 2B. I attend Leonora Secondary School. Yes, miss, I'm very happy about it. We get to learn about our health in the future and so, miss. Miss, it will benefit us to keep our body healthy and clean at the future and also at the present, miss.
Okay, is there anything you want to tell the Ministry of Public Health and all this organization who would have helped in making this possible?
Yes, miss, I would just want to tell and thank you very much for helping to make this room very possible for us to attend this room for HFLE class, miss.
First of all, my name is Italia Ramsroop. I'm from grade 8B. And this room benefits us from a lot because, miss, it's a very environmental, child-friendly room that we learn so much in. We come and we do fun activities, everyone, and also everyone is invited. Even older students are invited in this room. We play lots of games and it's a very eco-friendly environment for us.
So I'm Silandel Glenn, the Adolescent Health Coordinator within the Adolescent Health Unit, Ministry of Public Health. And we're here today at the Leonora Secondary School Health Hub Room. The room is a collaboration between the Peace Corps of Guyana, Ministry of Education and Ministry of Public Health. Now, in terms of adolescent health, we will be supporting the school with our School Health Club initiative, which will be executed out of the room. Now, our secondary school health club initiative is one that we seek to promote health and well-being of our in-school population. So the Adolescent Health Unit will train the teachers and students of the school to become members of the health club and facilitators of the health club. Now, when they're trained, they will be able to disseminate information and services to the entire school population on sexual reproductive health, gender-based violence, substance use, mental health, and all the other issues that are affecting our young people when it comes to health. What Adolescent Health is trying to do is to ensure that our in-school population is equipped with the knowledge and information to become better adults. As we know, if you don't take care of yourself when you're adolescent, when you go into adults, you could suffer from various chronic illnesses and other diseases. And Adolescent Health, we're trying to prevent that. We're trying to contribute towards a healthy population and a well-molded population. So that is basically our role when it comes to the School Health Hub Room.